Implants have changed a lot since I started placing them. Over the last 20 years, implants have changed from being only able to place them just praying, hand-free, just praying that will go in the precise location or in a good location, for the patient in between patient's teeth, having all this, advanced technology available. And of course, in our practice, we embraced all technology possible so we could offer the best for our patients. So in today's world, I have the cone beam scanner, the CBCT, that basically shows us the quality of the bone, density of the bone, amount of the bone, width of the bone. And from that, we digitally design specific dental implant softwares where the implant will go in what specific area, in the most dense area where the bone is the widest. And it also allows us precisely to choose the size and the length of the implant, no guessing work. So basically the implant placement is more precise. The surgery length is much shorter, and patients care about that. They don't want to be doing trial and error, just a much long-term predictability and success for the implant placement for the patient. Two important factors that decide if the patient is a good candidate for implants is the bone quality in that area, density of bone, height of bone, width of bone, and then the second important factor is the patient commitment to basically home care, maintaining good oral hygiene, and basically coming in constantly to their regular hygiene visits to make sure that the area is clean and the implant is protected from any potential infection. 3D imaging has helped me place implants more precisely, definitely. I mean, it has improved the treatment outcome tremendously. It gives us the ability to see the surroundings of the bone, the density of the bone, measuring by portions of millimeters how far are the rest of the teeth from the area that you want to place the implant. So basically, being able to digitally pre-plan for this implant placement or multiple implant placements for a precise treatment, basically a long-term, also lasting treatment for the patient. PRF treatment is a regenerative treatment in medicine, taking a small sample of the patient's blood and centrifuging that sample, extracting platelet-rich fibrin, injected into the dental socket side or the specific treatment we're treating. What it does, it enhances healing because basically it has the ability to increase production of collagen, and which is essential for more guaranteed bone regeneration and any tissue regeneration, whether we want to regenerate the gum in that area, whether we want to regenerate something called connective tissue in that area. So definitely more predictable outcome for bone regeneration around the implant, which is basically a primary need for implant success. And also it reduces inflammation. Basically, it enhances healing. The healing process is much easier with PRF. It's understandable that most patients or most people are concerned about implant costs because it is definitely an investment in your dental health. But again, we have one set of teeth, so we guide people through understanding the value of this investment to restore their bite. Because when we're missing a tooth or two or three, and it's not only affecting the area of where the tooth is not there, it's actually affecting the entire mouth and the rest of the teeth. The rest of the teeth gets compromised, they suffer from mobility. So we do have financing options, payment plans, and there are multiple scenarios with these actually, depending on the patient ability, trying basically to make sure that it becomes affordable over time for the patient and stage the treatment for the patient so they're able to afford it and also receive the high standard of care of the implant treatment. In my experience in my dental practice, the type of implants we choose and the technology and the planning involved in placing these implants, they last for a long time, as long as the patient is maintaining home care and keeping their regular hygiene appointments. They last for a very long time. In the rare cases, they do fail, but very, very rarely compromise, bone density, which we discuss with the patient all the time. And sometimes they still choose to basically take the chance and, go forward with the implant. And the other main factor is basically home care, lack of oral hygiene, lack of good oral hygiene. But again, it is very rare in my experience. They have a very high success rate. If we remove a tooth or a tooth is lost, In some cases, we can place the implant, in the same visit if there is enough bone. If tooth socket did not have an infection present right now, we could place the implant. So again, quality of bone, amount of bone, and the health of the tissue, lack of infection. But if there is infection there, if there is a diseased gum tissue there, not enough bone, most of the time we have to add bone, close the area, maybe prescribe antibiotics. We want to make sure that the best predictable outcomes. So sometimes we do have to wait 3 or 4 months before we go ahead and place the implant for the patient. The coolest thing in dentistry and in regeneration treatments in general is PRF. PRF is revolution, in the biologics. The ability to regenerate bone, to regenerate gum using the benefit of the amazing proteins in our own blood, and regenerating more collagen. It's just, an amazing thing that's possible for our patients nowadays. And again, by being proactive in embracing all of these technologies and really precisely working on honing the skill of how to extract these elements from the blood, because there is science and there's technique to it. And I'm really, really passionate about that because it's an amazing field in regenerative medicine nowadays.